Hi, I'm Lawrence Bergstrom, osteopath of over 20 years experience of treating spinal injury and disc problems, and also an advanced trained non-surgical spinal specialist. I want to talk to you today about spinal discs. A lot of people aren't aware of discs or their spine at all, so I thought this explainer video might give you a little bit of useful information. So we're going to start with a bit of basic anatomy. So if we look at this model, we have two bones called vertebrae. In between the vertebrae we have a disc. Now the disc is made up of fibrocartilage rings, a little bit like if you can imagine the dough in the donut, and then the center of the donut we have something called the nucleus. And the nucleus is made up of protein and glucose molecules. Now the spinal disc is a shock absorber in part. In addition to the two bones or the vertebrae and the spinal disc, we have the central canal or the spinal canal, and this houses and protects our spinal cord. Coming off the spinal cord itself, we have peripheral nerves, which you can see here, which pass through little windows called foramina. And behind, so this is at the back of your back, we have facet joints, and you can see those opening and closing, and those side bend, rotate, open and close. So you've already now got a good working knowledge of your spine. Many patients come to us, they're aware of back pain, but they know nothing about their spine, nothing about how it works, and no anatomy. And one of the key things that we love to do at Swell Back Pain Clinic is educate you. It's your spine, you need to understand how it works, and you need to understand what's wrong with it, and you need to understand how we and you can help to resolve it. Now, what I wanted to discuss with you today particularly is disc injuries, because that's what we specialise in treating. They have very specific forms of behaviour. So let me tell you a little bit about how a disc injury might feel to you. Sharp stabbing pain, unable to bend forwards, unable to touch your toes when perhaps ordinarily you could, unable to bend forwards, say to dry your feet or to wash your feet in the shower. You sneeze or cough and you have dramatic pain, can't turn over in bed, can't sit down, can't get into your car. If you sneeze or you cough, really severe pain, not just a bit of backache, but world-ending pain, just stops you in your tracks. In addition to that, you may also have radiating pain down your leg, if it's going down the back of your leg and into your foot and into your buttock. We call that sciatica. You've probably heard of sciatica. If you've got pain on the inside of your leg and your big toe, maybe second toe, or on the inside of your thigh, then that's another form of radiating nerve pain, invariably originating from your low back. And what's causing that? Often a disc bulge. Now, if I come forwards and I show you this, you should be able to see now disc material moving. That's when you've got a really swollen disc, which is now catching nerve. Now, you can have a disc injury and not have nerve pain, and so the pain can be diffuse, widespread across your low back. It can start to centralize into a given area, maybe more into your right side or left side of your back, and or you might have back pain and leg pain, or neck pain and arm pain. Or you could have pain down your arm and no neck pain. You could have pain down your leg and no back pain. How does that work? If your disc isn't torn, for example, but it's bulging sufficiently, you only need 0.5 of a millimetre, half a millimetre of pressure on that nerve for long enough, the equivalent of a fly landing on it and staying there, and it's going to start to interrupt the electrical activity, the lightning fast electrical activity up and down the nerve. That's going to manifest as sensations. You're going to feel something. It could be burning pain, shooting pain, numbness, cold water sensations. Any of those things can occur down your arm, or down your leg. Okay, so if you're getting those kinds of symptoms, you want to be speaking to somebody, you know. Don't leave it too long. The problem is the longer you leave it, it can get worse. It may not, it might resolve on its own, or it might be transient. That is to say, you have it for a while, goes away. You have it for a while, goes away. Starts to become more of a feature, starts to become more severe. You really need to be talking to somebody at that point, because the longer you leave it, the longer it's going to take for your nerve to recover. And if you've got a problem such as a disc bulge, swollen disc, greatly degenerated disc, that's putting compression on your nerve, it's going to end up being more of an issue. Why do discs become a problem in the first place? Generally speaking, most people before the age of mid-20s, say, don't have disc problems. There are exceptions, injuries, genetic causes on occasion, but generally we don't have problems. Why? Because we have a high level of elastin, connective tissue, elasticity. We bend, we move, we do all sorts of things. The tissues accommodate it. Unfortunately, and it's the same for cats, dogs, horses, probably other creatures as well, as we get beyond a certain age, our connective tissues become less elastic, and therefore they struggle to respond to the stress that's put on them so easily, and we're more prone to injury. So an analogy that I give to our patients is, if we're thinking about a spinal disc, up to your mid-20s, say, it's nice and bendy, it responds well, we bend, we move, we twist, we do all sorts of things, it responds perfectly well. Problem is, imagine you put new tyres on your car and you looked at the surfaces of the tyres, they're pristine. Other than the little pimples from the mouldings, the surfaces are pristine. Drive 300 miles, look at the tyres again, and now what you've got is all these tiny little fissures, these little imperfections in the tyre surface. Tyre works fine, gets you from A to B without any problem. Similar with the discs, most of the time it'll function, you'll move, you'll do things, you won't have any problems. However, when you get the wrong confluence of forces, that is to say, 2 or 3 forces combined at the same time on one of these little imperfections, trouble arises. So what happens is we bend forwards, we side bend, we rotate at the same time, perhaps under a little bit of load. Could be pulling your sock on, could be pulling a Wellington boot on, it could be lifting a small child or a small dog. And then what happens is one of those little imperfections splits. Now, as it splits, you've now got a tear. Now, the problem with discs, tendons, ligaments in human beings and some other creatures and mammals is they have a slow, sparse blood supply. They do have a blood supply, but it's minimal. As we get older, because we're compromised in the elasticity, the ability of these tissues to respond quickly to stress, they get injured. Once they get injured, the blood supply is poor, so they're slow healing. Further to that, if I just grab our model again, the disc is perhaps degenerating in height to a degree. The disc's ability to pump, what we call the physiological pump, is compromised. And so the expulsion of toxins in the disc, waste products, slows, so it becomes more acidic. The acidic nature within the disc stimulates what are called neuroceptors or proprioceptors and nociceptors. So the movement is compromised. The pain receptors are compromised because the chemical balance changes in your disc. And so your nervous system is stimulated, and that leads to pain. Okay, so you end up in a situation where the mechanics of the joint are compromised to a degree. The physiology and the biochemistry in the disc is compromised. That then leads to problems with the nerve. Now, what we want to do, we want to optimize blood flow into the disc, fluid flow, so water, because the disc should be about 80% fluid. but you can have 4 or 5 problems with one disc. It can dehydrate, you can get tears in there, it can start to bulge, it can start to prolapse. So one disc can cause you lots of problems, okay? So going back to what we were talking about, getting to your feet first thing in the morning, trying to get dressed, getting on with your day, loading the washing machine, the dishwasher, picking the kids up, physically lifting small children, these kinds of things. Just trying to sit down, can be impossible. And these are the hallmarks of disc injury. Now, minor cases will resolve on their own. Sometimes they herald the start of problems further down the line. You might have an initial injury, resolves itself, think, forgotten all about it. Year later, 2 years later, your old friend returns. Oh, I remember this, and it's hanging around a little bit longer, it's taking a bit longer to resolve. That's often evidence of further degeneration in one or more discs. And in another talk, we'll talk about when you get multi-level changes, but for now we'll just focus on one disc. So there are things that can be done: manual therapy, hands-on therapy, exercises, awareness, mindfulness of how we're lifting. In a lot of cases, minor disc injuries will settle down, you'll manage them well, they can be managed conservatively. However, when you get to the point where your disc pain is ruling your life and your nerve pain is ruling your life, you've got a problem now. It's not going away on its own. So that's when you need specialist advice, specialist help, specialist care. And that's what we're here to do at Swell Back Pain Clinic. This is what we specialize in. Okay, so if anything from this talk, this video rings bells with you or a family member or a colleague, and you think it sounds a lot like what I'm suffering or they're suffering, then call us, get in touch. Perhaps just a bit of free advice or initial advice will be enough to set you in the right direction. But if you're suffering severely, number one, know that something can invariably be done. 92% of our chronic pain spinal disc injury patients, we either greatly improve or resolve their problems because we have a specialist system. Yes, we have state-of-the-art technology, but in addition to the technology, we have personal knowledge about disc injuries. I've suffered myself. I've been personally disabled with spinal disc pain in years gone by. 18 months housebound, unable to walk properly, unable to do anything. That was a long journey. And I promise you, I didn't have the knowledge then that I have now. But that's been very helpful because when patients come into my clinic, I recognise the problems invariably. We also use other modalities, of course. MRI, extremely useful in diagnosing disc problems. We can refer you for MRI, your doctor can do that, or we can do that for you. And we can diagnose the problem for you because number one, you want diagnosis, and then of course you want the appropriate level of treatment for your injury or injuries, because as I mentioned earlier, you might have 1, 2 or 3 disc injuries. There'll be a primary one, there might be a secondary, there might be a what we call tertiary or third problem. So we want to get to the bottom of that, get to the root of that. Also, we want to make you expert in your spine, okay? Because I see it time and time again. I've just finished a consultation with a patient, knew nothing about their spine, had an MRI, told nothing, knew nothing, completely confused, quite frankly, terrified. He's left in the driving seat now, decision making, knows exactly what's wrong, hugely relieved, ready to go with a course of care, and we can resolve his problem for him. So, any thoughts or queries or worries that you've got a spinal disc injury, get in touch. You can call us at the office, 01795 720 326. You can find us online at www.swellbackpainclinic.co.uk. Reach out to us and we're here to help you. Thank you.